So we've heard 5 very different and interesting perspectives here, and I am going to wrap up by talking about the end of my case study research, which was essentially speaking to people and saying, great, you've recognized all these challenges in Hong Kong, you've seen all these opportunities, what is stopping them coming to fruition? I'm sure this is just the start of a list, but here are the main things that people brought up. First of all is this challenge with stigma. Like, if you are not able to talk about mental health, then you're not going to suddenly start funding it and prioritizing it and shouting about it as something that you think voters are going to want. Because if things are taboo, then nobody really wants to mention them at all. So the fact that nobody can really speak about mental health, and it doesn't sound like a positive thing that people necessarily want to associate themselves with, is actually stopping progress in this field. Then there's awareness. This is a problem with all prevention things. If you see something that's wrong and you spend money and you fix it, everyone's happy. But if you're trying to prevent something, then at the moment there's not necessarily anything wrong. So you can't point and say, look, I fixed that. And I think that people find it hard to conceptualize that way of spending money. This challenge of economics, land's always given to the highest bidder, and how the design benefit society is, well, is less relevant potentially, is the perception. Highly regulated buildings, it's not enabling, there's so many regulations and so many of them date back to pre-handover times and are not really amenable for various reasons to be changed too much at the moment. Then it feels like that people are not able to innovate, there's not that much scope for doing things differently. And then also, because of the way that the system works, as I mentioned before, it's hard to collaborate across sectors. Because people are reporting upwards, they're not really set up to be able to report across the way. These are some of the barriers that people brought up, but of course I'm sure that that is just a sample of some of the challenges here in Hong Kong. So I guess that when we've heard about all these really interesting opportunities, we need to think about what we can do about these barriers. I'm going to finish the talking part of the section with the much promised film premiere. This is a 2.5-minute film premiere, so don't worry people, you're not here for the evening. The Faculty of Architecture here at Hong Kong U have an urban lab where they bring together architecture, design and health and various other specialties to think about the future of Hong Kong. And in order for them to share what they're doing and why they're doing it, they've made us a sci-fi film. Prepare.
The year is 2030. 6 out of 10 people in the world now live in cities, and some are predicting 100% urbanization by 2070. Cities are growing inexorably. The benefits of the city, trade, culture, and the promise of wealth make the cramped living conditions bearable, at least for a while. But with increasing population density has come limits. At first they were, as you might imagine, diseases spread quickly, so as with battery hens we pumped antibiotics through the ventilation systems to keep the population healthy. Architects have made the crowding more bearable, but there's only so far you can go in designing small spaces for human beings. Many of the rich live in pods no bigger than 2 meters cubed, whilst the poor live in what, from their emergence in Hong Kong earlier in the century, we call cage homes. These are the smallest spaces in which we can physically fit the ventilation, lighting, water and security systems necessary to sustain a human being. And they are vertically stackable too. But how high or deep can we build? 10 years ago, the first 1 kilometer tall building was completed, and some Chinese cities are now housing people underground. But what we didn't expect was the effect density had on our minds. It isn't disease or technology, but our mental health that ultimately limits the human packing density. Without space, or light, or nature, the human body can survive, albeit in a state compromised by chronic diseases, but the mind grows weak, insular, depressed. Our overcrowded cities are monuments to human power and ingenuity, but as always, over the history of civilization, they push us to the limits and, ironically, threaten to become our undoing.
Congratulations on your film launch, Hong Kong Urban Lab. They wanted to be here in person, but I think that most of them had to go to another conference and were unable to make it. But I think that it's interesting that it brings up some visions of the future and some thoughts about why we should probably act now. Okay, so that is the end of our presentation section. Thank you so much to all of our presenters. That was really, really interesting.